I just felt really safe, which is number one for me. Like, I felt really comfortable and like I was in very good hands. My name is Kate O'Connell. I am a registered nurse. I was diagnosed with triple-negative stage 3B breast cancer last year around this time, May 2018.
When we deal with people who are in healthcare and get breast cancer, we come to realize that they're no different than someone who doesn't work in healthcare. The reality is that this is a terrifying experience when you first get the news that you have breast cancer. Every woman, when you first meet them, it is an overwhelming process.
So I did chemo, 16 weeks chemotherapy, and then I had my surgery. I had a double mastectomy with Reconstruction. So that's when Dr. Tanna kicked in. Dr. Tanna was great. Like, we had a lot of conversations, obviously, about it. And, you know, because I'm a nurse, I'm persnickety. So I probably drove him crazy a little bit. But we really went over all the scenarios. I did a lot of independent research myself.
I talked to Kate. It becomes apparent that just because she works in healthcare doesn't mean that she's going to experience journey or this process any differently than anyone else. And so it's important that we talk to our patients as people.
Important thing is, just taking it easy and getting through each step, with the best outcome possible. So, of course, Dr. Tanna and I talked about that. There was no advantage to rushing. In fact, there's a possibility of ending up with a poor result or a real problem, real complications.
Breast cancer can be scary. It's important that we take the time to educate them. Tell them that everything will be okay in the end. Kate will tell you, as a healthcare professional and as a patient, having been on both sides, that you will be okay. And that's what we tell our patients, you will be okay. But like any day for anybody, there are going to be some good hours and there are going to be some bad hours. There are going to be some good days and there are going to be some bad days. In the end, though, you're going to be fine.
Ultimately, you have to kind of come to a place where you make a decision that you feel is the best decision for you.
It's important to take the time to explain to patients things like, am I going to get a bra after surgery? Am I going to be doing rehab after surgery? What medications am I going to be getting after surgery? It's important to explain this to all patients.
There's some moments for me, certainly in radiation, breast cancer is absolutely no picnic, and I would not wish it on my worst enemy. But you quickly see that there's a lot of suffering going on in the cancer world, and I'm like, yeah, okay, I can handle this. Oh, these tissue expanders, they really suck. But I can handle this, I can get through this to keep this body on the planet, I'll go through it.
And it's important that family realize that they too may need support. They may need to ask us for advice or ask other patients how they dealt with it.
Well, I think you have to have confidence in your medical team first. And I think, again, like any major life change, this is going to bring up everything about who you are anyway.